On one side, you have a great desire to have rapid access to the latest stuff in healthcare. At the same time, you want to be reasonably sure that those new things are safe and that they actually do what they say they're going to do. And that takes a certain amount of time and energy and resources to conduct the studies that will provide, that sort of information. The Green Park Collaborative is trying to be the platform for the comparable discussions that address information needs of all the decision makers that come after the regulators. So that includes payers, the folks who the health insurance companies who actually have to decide which drugs and devices and diagnostics to pay for and how much to pay. It's also true and useful for clinicians who are trying to help patients make clinical decisions, and also patients. Over the last 10 years or so, the decisions by payers are much more influential than they used to be on which technologies are used and when, and how broadly. It's through that kind of multiple perspectives, both from a technical point of view as well as a decision-making point of view, that we can come to some convergence around what kinds of studies need to be done. And then the ultimate output of the Green Park Collaborative that emerges from those conversations is a series of specific recommendations. In the kind of current state, without a lot of standardization and guidance, you have a lot of kind of conflicting or difficult to understand studies of the same questions that really don't allow you as a patient or as a clinician to have a high level of confidence that you are making the right choice. So the whole idea here is, let's have as much consistency and uniformity as we can on how those studies are designed. So that's helpful both for the decision makers because they have better evidence, and as I said earlier, it's really helpful for the people who are doing research because they have much clearer understanding of where and how to invest their research dollars. If the Green Park Collaborative is able to help facilitate greater consensus and consistency and clarity about what kind of evidence is needed to inform clinical and policy decisions, it could potentially have the effect of making the whole medical innovation process much more efficient, much more predictable, much less risky, and therefore, overall less expensive.